Today's topic is the truth about pain management and alternative therapies. And for the purpose of our video recording, for those who can't be here today, my name's Brett Janelle. I'm one of the moderators, co-hosts and founders of the Truth Series. And I just wanted to welcome you all for being here today. So thank you for coming along. So just a show of hands. Did anyone receive the AARP bulletin last month, June, titled Chronic Pain? Show of hands? Quite a few of you, yeah. So I think AARP must be looking at our schedule in advance and are trying to be one-upping us by covering our topics the month before we do them. Because this has happened like 3 times now. The month before we do the topic, they have a big article on the topic that we're doing. And our seminar schedule is put out, like a year in advance. So, yeah, I think they must be looking at what we're doing. Wouldn't that be a nice compliment? I think it's just coincidence. So, anyone here dealing with pain? Who's wanting to, yeah, we all have aches and pains of various different types. So I have 3 amazing panelists today who are going to help us talk about, is pain a normal part of aging? What are the different types of pains if we don't already have pain that we might be looking at? And more importantly, how can we deal with pain and how can perhaps we mitigate or minimize pain that we might be dealing with? So I would like to have our 3 panelists come up here and join me. Let me turn on their microphones. So for those who are new, I'm going to ask questions on your behalf of the panelists for the first roughly about an hour to approximately 11 o'clock, and then we'll open it up to the questions you might have of the panelists. What I'll ask you to do as we go through this, just hold your questions, write them down on the handout that you have, and then when we get to the Q&A time, then we'll handle as many questions as we can in the time we have available. So maybe I could start with you, Jessica. Could you introduce yourself, who you are, the organisation you're with, and why you would be on the panel today on this topic?
Am I on? Hi. I am Jessica Urtinis. I am the Assistant Director at the Nevada Geriatric Education Center at the Sanford Center for Aging. I have 25 years of experience as a physical therapist, so pain is the name of the game I deal with almost every day. I think that's all I got.
Yeah, that's a great start. Yeah, fantastic, because we've got lots of questions for you. AJ.
Good morning. My name's AJ Reed, and I am a nurse. I've been in our community also 25 years. My big background really is in oncology nursing. I've been a hospice nurse for the last almost 15 years, and really work with a ton of older adults and pain management and establishing appropriate pain management plans.
Thank you. Dr. Keating.
Hi there, Dr. Casey Keating. I'm the medical director for pain with Renown Medical Group, and I'm a pain specialist. I'm also a specialist in physical medicine and rehabilitation, and I'm a PPR certified pickleball coach.
Any pickleballers here? Yeah, round of applause. All right. So I'm feeling really old sitting between these 3 because they're talking about their 25 plus years of experience, and they must have all started when they were like 5 or 6 years old because they all look so young. So you guys are obviously all doing something right. So be so youthful. So the first question I have for you is what are some of the most common types of pain that we experience as we age that are different to what someone more youthful, younger would encounter? Maybe I could start with you, Jessica. We'll just come down the line.
Yeah, so in my career, most of the pain I deal with is musculoskeletal, arthritis, back pain, neck pain, and to be honest with you, I see it throughout the course of life. So yes, can we get a little bit more pain as we get older, but it does change a little bit. We have more of that arthritis, that degeneration. So that's kind of what I see. I also deal with a little bit of that neuropathic pain from herniated discs, some of that nerve pain that'll go down your legs or down your arms, that kind of stuff. So that is mostly what I deal with as far as pain is concerned.
So just a quick question on that. Is it a truth or myth that we're all bound to experience pain as we age?
No. I think it's a myth.
That's a myth.
Yeah, I think that we're bound to experience pain here and there as from now until we, pass. However, it's not something that's inevitable. I think that if we learn how to take care of ourselves and what we can do for our bodies, it doesn't mean you're going to have pain.
Okay, thank you.
as you age.
Yeah, awesome. AJ, from your experience, what can we look forward to potentially as we age in terms of pain?
Well, a lot of times people do really pretty well, but some of the things that I've seen in obviously oncology and in hospice, some of the pain that we see tends to be associated with the arthritis. Sometimes people have pain from neuropathy, from diabetes. Sometimes there's decreased blood flow. We see that with peripheral vascular disease or peripheral artery disease, where we have decreased blood flow and can have pain with walking. And then we have pain that I see associated with an illness, cancer pain and some of the other things. Not always a thing that we see, but very treatable, and there's a myriad of ways to treat pain based on an individual's goal of care, and I think each one of us kind of have a little bit of a different perspective on that, so excited to talk about it.
What about you, Dr. Keating? What do you see in your practice, people coming to you in terms of dealing with pain?
Sure. So when we're younger, we often have an injury that's going to get better if we ignore it. That's the luxury of being young. You can sprain an ankle and wait a few weeks and you're probably going to be feeling better. As we age, we're more likely to have degenerative causes, so the arthritic causes, back pain, neck pain, knee pain, that may not get better on its own if we ignore them. So being as proactive as we can and being active can be very helpful for this whole process.
And what are some of the specific pains that you see people come to you for?
So some of the most common causes of pain that we see are just chronic low back pain is probably the number one diagnosis that I see. It's not getting any better on its own. It can be from various causes. So back pain is a symptom. It's not necessarily a diagnosis. So one of the big things that we do as pain specialists is see if we can diagnose the exact cause of your pain and treat it at the source. So rather than trying to mask the problem, can we find out what's causing this and have an individual plan for that particular patient?
Thank you. So can we perhaps discuss what are some of the different approaches to treating pain in each of your specialties? So maybe I can start with you, AJ.
So I think one of the most important things when we're meeting and talking with individuals that have had pain or pain management issues, the first thing that's really important is to understand a person's goal of care. There are many different ways to treat pain. There's pain medication, there's anti-inflammatories and steroids and nerve blocks. And there are a ton of things that we can do medically to manage pain. But not every individual really wants to utilize pain medicines like narcotics. So what are some of the other things that we can do? And I think especially on the hospice side of things, we do look at some of the holistic approaches so that people can have a little more wherewithal and be interactive. And as we have activities going on in our lives, we do want to search out sometimes other ways. So acupuncture, guided imagery. So what are some of the other things can we do? Lidoderm patches. So there's a ton of different things that can be done for individuals, but I think developing a plan of care around an individual's goal and what their life looks like on a daily basis is probably one of the most important things each one of us can do as a healthcare provider.
So you specialize in hospice care, so typically end of life, but all the things you mentioned, do they apply only at end of life or irrespective of our age and our condition?
Not at all. I think even people that are dealing with chronic arthritis that can impair movements and things that they do every day require some sort of intervention. So what are the things that we can do to help them have the quality that they're looking for, whether it be hospice care or just our daily lives? It applies all the time.
So you mentioned guided imagery. Is that some surgical procedure or?
No, actually, really guided imagery is a relaxation technique. So what we're looking for are how can we help somebody relax? When we're having pain management issues, I think everybody in this room who has had pain, you're not at the most relaxed state in your life. You're pretty uncomfortable. You're tense. So one of the things that we do talk about are finding ways to relax, guided imagery. Guided imagery is painting a picture in your mind of a place that brings you comfort. Sometimes we put music on, dim the lights, talk to the people that we're working with about what's one of your favorite places. Close your eyes. Talk me through what your favorite place looks like. Is it someplace warm? Can you feel the sun on your skin? Can you feel the warmth of that sun helping your body relax? At the end of the day, guided imagery is really just a relaxation technique. Sometimes we talk about mindfulness or listening to your own breathing and trying to bring in a state of relaxation to help decrease those pain impulses that you're seeing and help the body relax.
Thank you. I see some skeptical faces out here. Where would we go to find out more or to experience that to see if it's something that might help us?
Well, just like any type of pain management, one thing's not for everyone, right? And so you have to find the things that work the best for you. But if you are dealing with chronic pain, finding ways to relax is probably pretty key for each individual in this room. Again, finding some favorite music, going to a quiet place. If you're looking for guided imagery, you can go on YouTube. You can look up guided imagery sessions. Sometimes it's just playing music. Sometimes it's a calming voice talking you through a beautiful place that you can visit in your mind. Sometimes it's the sound of nature. So you can find guided imagery based on your own tastes or what kind of fits best for you. Sound machines are great too. Those are different ways to do it. Amazon has some great tapes and CDs that you can purchase as well.
Great, thank you. So Jessica, can you share with us some different therapies in addition for dealing with pain?
So my expertise is physical therapy. I think that's a great way to manage and help you with your pain and your chronic pain. And what we do is look at, what does your body look like? It doesn't necessarily mean just because you've got back pain, is your pain coming from your back? We're going to look at your shoes. We're going to look at your, what's your flexibility like? What's your strength like? What does your posture look like? So it's kind of a whole body, evaluation. We're looking at like, what's happening with you and where do we need to focus in to help some of this pain that you're having? I'm a big advocate for movement. I think that as we age, we use this excuse of, oh, I'm getting older, I don't need to move as much as we need to, or as I did before. We need to move more. And it's amazing how much just getting our body moving helps with some of that chronic pain. And like I said, I would look at your posture. Do we have any imbalances with strength and flexibility? But sometimes it's a matter of, are you taking a walk after dinner? That's enough sometimes. Do you notice what your posture looks like as you're sitting here? I think I mentioned it, earlier. I think the average person, the average person can hold correct posture for about a minute. So then we start losing it. So these are the things that can contribute to some of this chronic pain that you have. And so, as a physical therapist, that's what I'm going to look at. I'm going to look at your joints and your muscles to see what we can change for your whole body to make your body feel better.
I'm just curious, who has been to a physical therapist sometime in their life? Oh, everybody. Okay. I didn't realize so many. I just had my first experience just 2 months ago. I had a fall. I'd had a fall, hurt my neck, went along to the physical therapist for my neck, and she goes, we don't need to work on your neck, we need to work on your posture, and that's going to fix your neck. It's like, ooh. But yeah, my posture has improved, hasn't it, Annette, over the last couple of months, doing all of these different stretches and things, and yeah, I just didn't realize how helpful physical therapy can be.
And I think that also part of my job is to educate. So I don't expect any of you to be able, or to want to go see a physical therapist the rest of your life. So part of the job of a physical therapist is to educate you. Let's find out why you're having those aches and pains. Let's find out where that pain is coming from. Not only just the medical diagnosis, but some of the other issues that can happen in your body. And then it's my job to educate you on what you can do. Everybody's not the same. Everybody's different. So we have to figure out why your body is feeling that way, and then go from there and educate you what you may need to do in the next 5, 10, 15 years for, what I call this body maintenance. We all have to do a little bit of body maintenance, and so that's something that I definitely advocate for.
Awesome. So Dr. Keating, what do you have for us in terms of therapies other than just taking painkillers?
Yeah, I agree with AJ and Jessica completely. One of my physical therapy colleagues says when it comes to our joints, motion is the lotion. You got to use it or you lose it. And so that's the first thing, is getting movement for everybody. And we can all move a little bit more, but anywhere where we are, we can just take one more step. And wherever that is, that's an improvement from that beginning. I think an example is age is really just a number. We think that things are inevitable and going to just happen to us, but we can be much more proactive. So there's 3 patients that I want to discuss that have the same diagnosis of degenerative changes in their knee with knee arthritis. And as AJ said, finding out the goal is critical. Otherwise, we as practitioners are just making up the goal on our own, but we want to communicate with our patients and make sure that we're going in the right direction. And so one patient actually is and they're all about the same age, in their early 70s, competes against me in pickleball at the same level. So that can be at any age. And so for this individual's goal, it was really to be able to play in a tournament. And so we were working on different knee stretches, exercises, and an injection in the knee to help calm things down so that he could do those exercises. For another patient, the goal was to walk his daughter down the aisle. And so then, that's a very different, very acute goal. We don't have months, we had 4 days. So for this patient, then we did a different type of nerve block that was really just going to carry him through the weekend, and we'll work on everything else down the road. So that's a very different goal. For the next patient, and again, all the same age with different goals, and I had to ask him about this because when he wrote it down, I had people write this down, it was very specific. He wanted to ride in a 100-mile race in Death Valley in the summer on a bicycle. So I had to make sure that wasn't a typo. It was ultra specific, but that was his goal. And that was 2 months away. He was in fantastic shape, but hadn't been able to ride his bike because of his knee pain. And so for that individual, he wasn't interested in a replacement yet. He was still very active, but we had a different procedure that's called a genicular nerve ablation, and this will last anywhere from 6 months to a couple of years for him. And so he's been able to continue training, and I don't know how he does it. I hope he stays well hydrated, because this just sounds crazy to me, but these are the goals that some people will have.
He sounds like he needs a referral to mental health. It's like, why? In the summer? Anything else?
I'm going to add a little bit to that, because we talk a little bit about exercise and movement. And I come from, again, physical therapy. You always think, oh, they're going to give me all the exercises. I've got to exercise. Only 20% of the population exercises. So when we say that we need to exercise, we're alienating 80% of that population. So I kind of got a goal and a mission to change the dialogue a little bit. Exercise doesn't have to be something we dread. I mean, we think about all the stuff did you guys enjoy coming in here today? Did you walk from your car? Guess what that was? Exercise. But it is one of those things where it's like changing that dialogue of like, does exercise have to be something we don't like? Sometimes it can just be some movement, and finding what your goals are and finding what you like to do really can help with how we get through some of that pain. And again, it doesn't have to be exercise. It can just be movement.
So if we're dealing with pain, how do we know what therapy we should be looking at? Because you've given us a whole range of different things. Where do we kind of start if what we're doing now is not working for us?
Try everything.
Try it, yeah.
And I'm a big advocate for being your own voice, your own advocate. So if you've tried something like this doesn't work, there's 100 other things out there that you can try, and it's just a matter of working with the right physician and working with the right people who will help you find what's going to work for you.
So being an advocate, when I go meet with my primary care physician saying that's not working, what else is there? Give me a list of other things I can try. Is that a reasonable approach?
You can bring that list into your physician.
Mm-hmm. Okay.
And starting with the least invasive possible. So if you've had knee pain for a day, the last thing I want to do on you is surgery. That doesn't make any sense. And so starting with something less invasive. So in general, increasing exercise, physical therapy, mindfulness, these are the first things that I would offer to people if they haven't tried anything, and if the pain's not severe and debilitating. Now, if they're laying down in the room and can't get up, then I'm not going to tell them, hey, go to physical therapy for 8 weeks and let's see how you're doing. We would want something a little bit more aggressive for that particular patient, which might include some pain medications and hopefully not an opioid medication. They are necessary in some circumstances, but that's not my first go-to for somebody that initially has pain. That's kind of a last resort that if we have to. And other options might be injections and then getting you started with the exercise program. So that's a pretty common modality that we will use.
Are some of us on maybe too many medications for pain that we're dealing with?
I think that a lot of us are on too many medications for a lot of reasons. I think this is polypharmacy is a big issue in the country, and I don't think it's intentional, but our medical care might be a bit more fractured than we would like. And so we don't really have Some of us have a great primary care provider, and they're the ones that are kind of the point guard or the gatekeeper. They're looking at all of our care and making sure that this all makes sense. But as a specialist, I can see it's challenging because I'm only doing maybe 5% of your medical care. And so when you come in to see me, we're highly focused on the joint pain or the back pain or what you came in to see me for. So I'm not making any necessarily other changes to the other medications that you have. So I think that having a great primary care provider and having that long-term relationship, they can help to pare down those things that you don't need.
And how many might be too many medications?
So there's not really a specific number, because if we have a cancer survivor that has a liver transplant, you need to take all your medications. Don't just say, I'm taking too many meds, I'm going to take 3 instead of 6. So I don't think there's a specific number. It's individual to every person, but I think every medication that we're on, we should be having at least some provider say, do I need to take this? And if the answer is yes, then you need that medication also.
Great. You wanted to add, AJ?
The only thing I was going to add to that too is, since we're talking about pain, I obviously in my industry deal with a fair amount of pain, but my focus is on quality of life for every individual that I'm helping to provide care for. And I think even outside of hospice or cancer, things like that, culturally, I think sometimes we tell people to not complain. And I think to a degree, a lot of people deal with some aches and pains, but when those pains start to interfere with your activities of daily living and your life, pain can be an indicator that something is wrong. It's our brain telling us that there is maybe an injury. And I think the one thing that I try to talk and advocate about is being honest about your pain, talking to your pain management physician, or talking with your primary care about what you're dealing with and trying to not mask it. I work with a lot of individuals that have severe pain, and when I go in and ask them, they try to downplay what's going on. But overall, chronic pain unmanaged will affect mental health and the daily life and can put us into a downward spiral. So at the end of the day, my biggest thing is advocating for anybody that has any pain in their life. Yes, there are some aches and pains that we have to deal with, but seeking medical attention for what's going on and finding a good way to manage your pain to meet your goals of care of daily life is incredibly, incredibly important.
Right, thank you. Jessica, did you want to touch on pharmacy? I know when we were doing our prep call, you were talking about medications and...
I'm going to do a little plug here.
Yeah, please.
We do at the Sanford Center for Aging have a geriatric pharmacist, and I would encourage any of you, and I think it's if you're on any 5 or more medications, you can, I think it's medication therapy management, and you can speak to her. And she will go over all of the medications you're on and help you go through, is this appropriate for me, is it not appropriate for me? And then she'll speak with your primary care physician or the physician you're working with to help you decide, and your care providers, what medications you truly need to get on. And that's kind of help combat some of that polypharmacy that we have out there.
Anyone here who's gone and met with Dr. Leslie Baker? I know we have some real advocates in here who have met and come up to me and said how helpful she was in terms of, eliminating medications or not realizing what different interactions were between medications, that maybe the 2 doctors hadn't talked and those 2 don't interact well.
Yeah, she's phenomenal. If you have any questions, I definitely encourage you to contact the Sanford Center for Aging and get a hold of her.
And how much does it cost, is what we're all wondering. How
free.
Expensive is this going to be?
It's free. All the programs we do have at Sanford Center are grant funded. So at this point in time, her services are free for any of you. There might be a waiting list. Leslie Baker.
That's the medical therapy management
Yes,
program?
medical therapy
And
management.
there's information outside on the speaker
No.
table. Sanford Center for Aging have some
Medication therapy management.
Medication therapy. What did I say?
Medical.
Oh, thank you. I think I said that to someone else this morning. They corrected me, so I got it wrong twice now.
Well, I think we've got flyers in the back.
Yes. Thank you. Anything else on that before we move on to the next question in terms of different therapies? So let's talk about holistic approaches then to our health. What other things should we be looking at to live a long, healthy life pain-free? Who Who'd like to start? AJ.
Sometimes there can be dietary changes. Those that are living with chronic arthritis, sometimes foods that we eat can cause increased inflammation. Those tend to be all of our favorite foods, like our carbohydrates and those lovely packaged foods. So trying to stay away from things that can cause inflammation can be something that we can do to decrease that inflammation, decrease some pain, stay away from those carbs and processed foods. There are vitamins that are associated with decreasing pain. Vitamin D can help decrease some bone pain. A lot of times if people have low vitamin D levels, they do tend to have pain in their long bones, like the shins. Vitamin D you have to be careful with because you can take too much of it, so you want to make sure to talk to your primary care doctor, but the omega vitamins can make a difference. Magnesium can help with muscle pain. So those are some dietary things that people can do. Other people do things like swimming, hot and cold, acupuncture, massage therapy. There are TENS units, which I bet Jessica can talk a fair amount about, that can help with some of the nerve pain that we tend to feel. Those are a couple of the holistic ideas that I had.
Great. Just go back to diet, nutrition. So you said carbs. So what are some examples that we would, in this room, or probably me, be having too much of?
Or me. Breads, pastas, those are my personal favorite. But a lot of times, especially if you have a busy lifestyle, we tend to get quick, easy meals. I myself have been a victim of making meals that came out of a box, and those are our processed foods. And those can be our big culprits of increasing inflammation. When we talk about dietary changes, sometimes we're looking more at the Mediterranean diet, the fish, the vegetables, decreasing some of our red meats. Those are the ones.
So you said no processed or packaged, so I see we provided chocolates to everybody. They should all turn those into me, and I'll take the punishment of...
I'm not going to take it that far because I'm a big proponent of quality of life. And if you take my chocolate away, it's all over.
Dr. Keating.
I had the opportunity to train in medical school at Loma Linda University, which is one of the blue zones of our country. I would routinely take care of patients that were over 100 years old, and very often they would be there in a multi-generational visit, so you would get to see a lot of people that were having healthy living in the same room. So very often there would be somebody in their 70s that looked like they were 40, somebody in their 40s that looked like they were 20, and somebody that was 100 that looked like they were 70. And so then, it was just amazing to see, what are you doing that I want to do for the rest of my life so I can live like you do? And so a lot of them would start with diet. So that was one of the most common things, is don't even shop in the middle of the store. All the good stuff is on the outside. Everything that's on the outside of the store is our fruits, vegetables, fresh foods, things that expire. And so if it expires and goes bad, then it's less processed by nature. So that was a good place to start with diet. Exercise is a huge part of their life. And like has been said before, the best exercise is the one that you enjoy, because that's the one that you're going to do. If it feels like a chore, you're not going to want to do it. And so some people, that would just be gardening, and that was it. That would be their whole exercise. They would just go out in the garden and tend that, and that's also a meditative exercise. So social was another huge thing. All of them had a big extended social network that they've had for years. They had friends that they would talk to that might have been friends since kindergarten or high school. And so having an extended friend group and being social and having some activities that you can do with others was a huge thing for them. And stress relief and sleep, things that we all need to do better. And so having that person that you could talk to, and then having a good night's sleep and setting that aside. So I think it's all the things that we know, kind of diet, exercise, stress relief, and sleep are really the cornerstones for healthy living.
So where was that again? You were in residency?
At Loma Linda for medical school.
Loma Linda. Okay. Are we all going to move there? So who is familiar with the blue zones? Because I know we did a seminar a couple of years ago and we talked about the blue zones. Just a few people. Yeah, so there was a fantastic documentary that we talked about, I guess it was 2 years ago, on Netflix. And I don't remember who the interviewer was, but he went around all the different blue zones around the world and interviewed people, and just everything you said, Dr. Keating, all of those characteristics. I think it was like a 6-part series. So if you have Netflix, I'd encourage you to go and search for blue zones. And it was a very good documentary. I don't know if any of you saw it at all.
Yeah, it was great.
Yeah.
And also a plug for pickleball. You get almost all of those things in there. You get exercise, social.
Are you throwing in free coaching?
I don't charge anything.
Perfect. Excellent. So Jessica, what did you want to add?
Oh, well, I was going to say I'm in agreement as far as a holistic approach to pain is also a cultural change. We live in a society, it's a very sedentary society. And I think we need to change that. It's not just you need to do this. It's like we as a group need to change the way we think about exercise, the way we think about diet. And that itself is going to help decrease our pain. So it's that big cultural change. But I'm also a proponent of, kind of what your mind does. I think I had mentioned at one point in time, they did a correlation study about whether or not you're going to heal from your back pain. And the only thing that they found, whether or not you're going to heal, is whether or not you liked your job. So what does that tell you, though? What does it tell you? It tells you that maybe your attitude and what you're feeling, and if you're happy, if you're not happy, these are also big parts of whether or not you're going to have pain. So it is one of those things as far as this holistic approach. Yes, we can look medically at what's happening with our body, but we also need to look inside and think about what's happening with our mental health. And I think that's also a big part of this holistic approach to pain management.
We have similar studies in the cancer realm, that patients that have had breast cancer, one of the risk factors that they looked at was hopeful or hopeless. And the people that were hopeless tended not to do well regardless of the stage of their cancer and treatments. And the patients that were hopeful and had something to live for lived longer. And so even just our mental state and how we feel can affect our entire chemistry in our body and how things are functioning.
So rather than adjustments on the lower half, it's maybe from the neck up, what's happening up here?
Definitely, there's a mind-body-spirit connection that we've all known.
So if we realize perhaps we don't have the best outlook or positivity, what can we do? How do we change that? Any thoughts? Where would the audience go? It's like, yeah, I'm feeling down and life's not so great at the moment. How do I change that? How do I get out of that cycle? Any thoughts?
I think there's a lot of different things that we can do. What are the things that are attributing to the feeling of down and not being happy? If it's chronic pain, I think we've talked about a lot of different ways on how to manage it. Sometimes we just feel blue, and we need to go into a provider and have a conversation. Sometimes getting in and talking to a counselor, a therapist, a trusted friend can maybe change ways of thinking and how you're feeling. Once in a while, a physician may say, let's do a low dose of an antidepressant. But I think over time, if we're not taking care of our minds, our bodies start to go down and vice versa. If we don't manage our chronic pain and we develop depression from that, it's kind of a downward spiral. So I think trying to find the ways that are attributing to the sad feelings that an individual is having, trying to get to some of the root causes of that. Sometimes it's big lifestyle changes. We talk about downsizing a home sometimes. There are big changes that happen in everyone's life, and we've got to find ways to try to work through those. So focusing in on physically maybe what's transpiring, and of course mental health, they both play kind of hand in hand, and then seeking assistance is one of my first recommendations.
So we shouldn't be embarrassed to go and talk to our primary care that I'm feeling down and not quite sure why I don't have my mojo at the moment.
Nobody's happy 100% of the time, let's be honest.
And mental health has a stigma in America that it doesn't have throughout the world. So it should be seen as a sign of strength to ask for help when you need it, for any reason, including mental health. So that's something definitely to bring up with your doctor, and if you don't feel comfortable talking with your friends, and have a professional. One of my friends that's a psychologist said the great thing about him is that he's your best friend that you can fire. So if you think he knows too much, you can just get a new psychologist. Or if you're not getting along with him, then try somebody else. But he wants this to be something that we can all help everybody to get better, and it shouldn't have that negative stigma. I think something that helps that I'll talk about with my patients is that Michael Jordan had a mental coach. Kobe Bryant had a mental coach. Some people that we think are some of the strongest people from an athlete standpoint, and the pressure can be on the line with millions of people watching, they still asked other people for help. And if they do, then why not us?
Yeah, very good point. Jessica, do you have something you wanted to add?
I wasn't going to mention the mental health stuff. However, before we move on from lifestyle changes, I do feel it's important that we just talk a minute for about don't smoke. I think smoking is also one of those number one factors into chronic pain. It has physiological changes to your connective tissue, to your joints, and it is a very common factor into chronic pain and whether or not you heal well from surgeries, from illnesses. So I am going to plug the don't smoke. And if you do smoke now, it's okay to stop, and you can start seeing those changes now.
And we can tell our friends to stop.
Tell everybody to stop.
Everybody to stop. So again, what is that doing to us if we're dealing with back pain or whatever the pain might be and we're smoking? What's the problem for a lay person like me?
It can create physiological changes in your joints and in your muscle tissues and your scar tissues that inhibit healing, inhibit appropriate healing. So I know I, as a physical therapist, anytime somebody comes to me with surgery or pain and we ask them if we smoke, my number one thing is we're going to struggle here if they do smoke. And it will delay your healing. It will cause long-term changes in your body to prevent that healing from happening.
That's that important. AJ, do you have something you want to do?
The only other things that I see with smoking is a lot of times it causes the blood vessels to constrict and can decrease blood flow, which is then why we have problems with healing, like she was talking about with surgery. If you have decreased blood flow, you're not going to heal as fast as well. And then, of course, smoking can attribute to some of the other things that impact our daily life, like emphysema and breathing and all of those great things, heart disease.
Thank you.
And anytime we do surgery, there are risks, and there's always a risk that the surgery will fail. As a physician, it's one of the worst parts of my job, and is you can do everything that you can, and sometimes there's going to be a failure. It's always a risk. Smoking increases that risk significantly, to the point where I won't do the surgery unless we've quit smoking. I think it'll increase your healing afterwards. It'll reduce the risk of failure, and you'll feel better. And so that'll be the first thing that we work on before we're even offering the surgery in my practice.
Wow, good to know. So we talked about movement, but if we're in pain, do we really want to start moving? Like, it's a whole lot easier to sit here in my comfy chair with my back pain than actually getting up. So how do I overcome that, and how do I kind of get started if I am more sedentary? I thought I could just conserve energy and live longer by being sedentary, but it doesn't sound like that's the case.
So I know in my practice, if you came to see me with shoulder pain, I'd be like, all right, you're going to have a little bit more pain before we get you better. If you came to see me with knee pain, I'm going to say, okay, you're going to have a little bit more pain before we get you better. But we have this weird thing when it comes to like back pain and neck pain that we don't want to increase that pain. But if you want to decrease your pain and we want to increase your movement, sometimes you're going to have some pain in order to get yourself there. So it's okay to have a little bit of increase in pain. I tell my patients, hey, if you come in to see me and you're at a 6 out of 10 pain and you leave in the first couple weeks, I get you to like a 7 or 8, that's okay. If I get you to 10 out of 10, that's a problem. We don't want to go that much. However, as you're starting new exercises, as you're starting new movement and new lifestyle changes, you may find that, yep, I'm a little bit sore here as we first start to get these new changes happening in our body, as we start getting joints in new positions they haven't been in a little while, as we start moving your muscles and getting them to their lengthened positions that they haven't been in 20 years. You might have some pain before we get you better. And sometimes it's having that mental ability to get through it to see those long-term changes.
I think I can relate to that. When I haven't been running for quite some time, and then I go for my first run, it's like, oh boy, I feel like a slug, and this is hard. I want to give up, but yeah, as you said, you push through it, and then tomorrow it's easier, and the next day, and so forth. So, anything else on movement? How do we know when we're overdoing it and we're not helping ourselves? You talked about a pain scale just then.
Yeah, I like to use the pain scale. I also like to look duration. You know, if you start a new activity or you start a new something that's going to kind of change the way your body's moving, if you're have a little bit more pain for a day or two, I'm okay with it. If all of a sudden you're like, ooh, Jessica, I've had an increase in pain now for a week, 2 weeks. We need to look at what you're doing and change the way you're doing. That doesn't mean stop. It means change what you're doing so that we can get you moving in more of that less pain realm.
Anything else on movement from Either of you?
Yeah, so there was an interesting study that was done, and usually when you read some of these and you say, how did they get this through an advisory board, it's usually people that have no rights, and in this case that was medical students, which is a common one for people that don't have any rights. So basically they took healthy 20-something medical students with no pain and had them in this study lay down and not move for a few weeks, and then asked them to monitor their pain on a daily scale, and then at the end of the study. And by the end of just a few weeks, they all had pain. And they had aches and pains in their back and their neck and their shoulders and their hips and their legs. And so even young, healthy people with no problems, if they don't move for a period of time, are going to have pain. And then it makes us think, well, what if we get a busy life and we don't do anything? Then we're probably going to have the same pain that those young 20-somethings with no medical issues had. And so I think it's been said multiple times, but wherever we are on this spectrum, we can always do a little bit more. And that might be a 5-minute walk after dinner. It might be something as small as that. So we can always start to move a little bit more.
So if we all come and join your pickleball group, which is probably a really good idea for some movement, are we going to be in pain?
Likely, yeah. After the first day, it'll be a lot of movement. And so especially if somebody was an athlete before, so we'll have some people that might have been a college athlete but haven't done anything for 40 years, and something clicks in their brain, and they're like, I am 20 years old, and I am unstoppable. So I think whatever activity that we're starting, start slowly, and just start a little bit more than we're doing today, and just keep advancing from there.
Great, wonderful, great advice. AJ, you wanted to add something?
So one of the things I was just going to say when we talk about why is movement so important, like you mentioned before, it's a use it or lose it kind of scenario. Who has sat down in a chair for 8 hours and felt like you had the best quality of life? Sometimes after playing pickleball, maybe. But rarely do people say, after sitting in a chair for 10 hours a day, I feel so much better and I can do things. And I think we can look at things a couple of different ways. Yes, we want to decrease pain. Can movement do that? Sometimes. Stretching, yoga, physical therapy helps us kind of push through those pains, develop some muscle strength, improve balance, decrease falls. Those are all really, really important things to movement. Whether we call it movement or exercise matters not. But at the end of the day, as a nurse, my perspective with every individual that I work with is quality of life and keeping people happy. Sometimes that's with medications, sometimes that's with music. But my thing about quality is keeping people where they want to live. Who wants to stay at home as long as they possibly can independently? Who dreams of living in a skilled nursing facility? No, weird, so weird. No one's favorite place, right? They have their place when we've had an injury and they help improve our physicality so that we can get back home. But when we're talking about a use it or lose it type of scenario, movement, activities of daily living, showering, laundry, going to the grocery store, it's all movement and exercise. And if you guys aren't doing these things at home and are leaning towards more of a sedentary lifestyle, maybe not managing pain and not able to do these things, the likelihood of being able to stay home independently begins to greatly dwindle. So movement is so important in our daily lives to aid in keeping us where we want to be, at the end of the day. My grandfather lived to 102 years old independently in his home and only needed assistance the last 6 months of his life. He golfed up until 101. Awesome. Finding ways to move are so important. And granted, he's not maybe the norm that we see, but his mind was sharp and we kept him moving. Was I his favorite person all the time? No, because I was probably the one behind him prodding him to go do things. Let's get out and walk the golf course if you don't feel like swinging the club. But at the end of the day, I think my grandfather made it to 102 years old because he got to be where he wanted to be. And the way he got there was managing his pain. We worked on goals of care. We kept him moving, and he lived a very, very happy life. That's what I encourage everybody here to do.
I think you're going to have a very full pickleball group at the end of this.
It'll be fun.
So we briefly touched on our mental health as it relates to dealing with chronic pain, emotional health. Is there anything else we needed to talk about there that we skipped over? We talked about seeking help if we're dealing with, mental struggles due to pain. Did we really talk about emotional, how we're kind of feeling in relation to pain? Anything we wanted to add? All good? Let's talk about assistive devices. I know we talked about that earlier in the week. So what other devices are out there, and not just devices, maybe new medical procedures that can help us with pain? What are some? I know we talked about something as simple as a walking cane or a hiking pole.
Yeah, I feel like if you need a hiking stick, if you need a walker, if you need something that will help take off some of that pressure from a joint, from your back, so you can continue to move, there's nothing wrong with that. I tell a lot of my patients, grab one of those collapsible hiking poles, throw it in your backpack. If you need it because you're going downhill when you're done and it hurts a little bit more, use it. So there's also things, hot and cold therapies. Those will help. I'm an advocate for TENS units. Do you guys know what TENS units are?
Let's slow down and go back one. Hot and cold therapy. What does that mean for us who don't know what that is? Taking a cold shower and a hot shower and cold shower?
And honestly, it really depends on the person. I mean, nowadays you've got a whole bunch of people that love these ice baths. I'm not into it, but other people swear by it. And my views on hot and cold are, if it helps, use it. I'm not going to sit here and say, oh, you need to be using cold, or oh, you need to be using heat, because I've had people that respond differently to both. So it could be a 10-minute hot pack. It could be a 15-minute warm bath. It could be an ice pack that you stick on your shoulder after you've played pickleball. But some of these little things really can help you get through some of that pain so that you can continue doing what you want to do. And again, I don't think there are guidelines out there. In my professional opinion, you got to find what works for you, and either one of them could work for the ice, the heat and the cold.
Any ice bath people here? I'm just curious. Is anyone? Oh. No ice bath people? No. Sorry, go on.
And then I mentioned TENS units.
Yeah, so what's that?
TENS unit is it's a kind of a neuromuscular stimulation, basically, and it's a couple pads. It's a little box about this big. I have one at home, and I totally forgot to bring it in. But you put the pads around where you're having pain, and the way I like to describe it to people is it kind of gives you a tingling sensation versus that pain that you're feeling. And I've had a lot of patients that go home and they buy themselves a TENS unit, and they don't have to take as many pain medications. They're able to move a lot better. What it does is it targets your nerves. Pain travels on your nerves. Okay, so let's say your nerve is a freeway, and pain is able to go. It's middle of the night, pain is able to run as fast as it can up and down that highway, and so you're feeling the pain. You put on this TENS unit, and it's TENS, transcutaneous electrical neuromuscular stimulation. You put that on, and you put it in the middle of rush hour traffic. So instead of that pain being able to get to your centers, your brain, so you feel that pain, it feels just this nice, comfortable tingle sensation. So I am an advocate for that. It used to be 20 years ago, you'd have to get a physician referral and $600, $1,000. Nowadays, you can find one on Amazon for $20.
So that's a pretty inexpensive experiment then. So what kind of pain would I use? A TENS? What did it stand for again?
Transcutaneous electronic muscular stimulation.
Say that 10 times quickly.
I don't remember.
TENS. Okay.
TEN.
For $20 on
neuromuscular
Amazon.
stimulation.
So what kind of pain? Is this like for my knee? Is it for my shoulder? What would it help?
I've actually put it on just about anything.
Just about anything.
Knees, backs, necks, shoulders, ankles. I've used it with patients on just about any of those body parts.
I've got a bad nurse's back, bending over hospital beds for years and years and years, use it all the time. It's great.
Wow. How many people are familiar with a TENS?
Having our devices and our medical equipment in open view is helpful, because then it'll be used more. If it's in the bottom drawer and it's difficult to get to, we're probably not going to be using these devices. This is something that my wife is not a huge fan of, but it gets me stretching more, is I leave my yoga mat out all the time. And because if I put it away, I'm probably not going to use it. And I have a stretching strap, which is like a seatbelt apparatus that helps me to do some stretches, that stays out all the time. And that's right by my bed. And so every time I wake up in the morning, I have to walk over my yoga mat and my stretching strap. I'm like, yep, time to use that. So that just is a cue for me to stretch every day. I have patients that say they leave their running shoes by the door at all times. and they don't put them away. So then when they get home, they have to look at their shoes and go, yeah, I should put those on. And then they only run in those shoes. And same with patients with walking shoes. So if you have a specific device that makes you think of an activity, if you leave it out in the open and you have to see it, it's going to make you more likely to do that activity.
We'll feel really guilty when we're not doing that activity.
Exactly.
Very good. So what else in terms of assistive devices, equipment, or new medical procedures that might be helping us?
I was going to mention braces.
Braces?
Braces. Pros and cons to braces. Knee braces, back braces, you name it. I think anybody who's decided that they feel like they need a brace should see a professional to make sure it's actually something that you need. There's a lot of the stuff that you can get over the counter nowadays, and I've seen people use, like, let's say a compression sleeve for the knee that was inappropriate and actually caused issues and caused more pain. But I've also seen people that I'm like, hey, maybe you just need to put on the neoprene sleeve so you can go out and do that walking like you were doing before. So these are tools that can help. Just make sure you're using them correctly. If you're chronically using a back brace, maybe you're creating a little bit more weakness than you should have. So these are the things that, yes, you might find them over the counter, but make sure you talk to somebody to make sure you're using it correctly and when you should be using it.
So you're saying it might be providing us relief, but now we're compensating or not dealing with what the issue is?
Yeah, sometimes it can be more of a Band-Aid versus it can actually cause more problems long term. So it's just a matter of knowing, yes, sometimes they help. When should I take it off? When should I use it? Should I be using it all the time? So just make sure if you do choose to use any type of bracing that you get at Walgreens or CVS, talk to somebody about how you're using it to make sure you're using it appropriately.
Thank you. Great advice. AJ?
There's other assistive devices. I think most commonly people are used to wheelchairs, walkers, walker with the seat. Grab bars in showers can be huge. Toilet seat risers. If anybody's had to have some hip surgery, it probably was your favorite thing. But there are a lot of things to help people assistive device-wise in the home. There are little reachers or grabbers, that can help reach items. If you're in a seated position, you can't get something. Assistive devices can be huge, and I think the other thing when we're talking about assistive devices, I think most of us get to a point where maybe we're a little remiss to use an assisted device. And again, if you guys haven't learned already, my big soapbox is quality and happiness. Sometimes we have to use some of these assisted devices to be able to get out and do the things that are the most important to us. Some people are living with chronic pain. Some people, their pain level is high enough to impact their daily living. And if you're one of the individuals that is living with chronic pain and have some difficulty doing certain things, utilizing these assisted devices can be very important. But the one thing I also talk about with utilizing assisted devices and mental health and movement and all of the things is sometimes with chronic pain, we have to figure out what's the most important activity for that day. Maybe we want to go out and have lunch with a friend or a loved one or a family member. We have to think of the other things that we do in a day. Maybe it's not getting up and getting ready and doing laundry and doing meal preparation and then trying to get out to that activity. Sometimes with chronic pain, we have to alter our lifestyles, and then we've got to consider what are some of the most important things to us and how are we going to achieve those. So maybe I can't do the 3 tasks today that I wanted to do, but the most important thing for me today is X. The most important thing is for me to go grocery shopping or to get out and be with loved ones and friends for a day. So maybe with chronic pain, we need to use our assistive devices and really consider what is the most important thing for that day. In most of our heads, we're 15 and 16 years old, and we're going to do 10 different things in a day. And then our body's like, yeah, you're not 15 or 16 anymore. So we have to alter our lifestyle. And I think that's one of the things that we forget to talk about as a culture. But as a nurse, it's one of the main things that I talk to people about each and every day, because it doesn't matter where you are in healthcare or your age. It can still be a very important part of your daily living.
And from a medical procedure standpoint, so one of the most exciting things about pain medicine is that this is really put on the forefront from the opioid crisis. And so now we have targeted treatments that have been around that are becoming more popular and getting better funding and newer research and newer devices and newer techniques that we've been able to do over the last 20 years. And one of those big things is that the nerves carry our pain signal. So if we can alter the way that the nerve is carrying that signal, we can alter the perception of the pain and improve function. So that's kind of the basis of new age pain medicine is, can we identify the problem, identify a nerve where the problem is, and modulate that pain through the nerve. So a lot of that's with nerve blocks, nerve ablations, nerve stimulators. We have a lot of different techniques, but it's more exciting for patients because then we're treating the exact pain that you have rather than giving you a pill that makes you not care about anything.
So you're having good experience with that with patients then, obviously?
Yeah, it's been fantastic for our patients to keep them active and improve quality of life.
I too have seen some great results with exactly what you're talking about.
So how does someone end up talking to someone like yourself? Is it my primary care is going to refer me over to you, or how does that work if we're not familiar?
Yeah, so typically a referral from your primary care provider, and then they would just get at least an x-ray of whatever's affecting you, so we can go over that at the visit, as well as a comprehensive physical exam and history and physical.
Okay, right.
Yeah, so just a referral from primary.
Before we jump to questions from our audience, is there anything we haven't covered that you want to add?
The only other thing I was going to say is Medicare does help pay for some assisted devices. So if you're a Medicare recipient, you can have a physician write an order and they will pay for some of the equipment. So that can be, a great way to obtain some of those assisted devices that you need.
Okay, right.
And I'm just going to add to that. And yes, Medicare with help, but also remember that the price difference between getting a cane and a wheelchair is pretty significant. Medicare doesn't pay for one every single year. So if you're like, ooh, I might need a wheelchair in the next couple years, just go to Walgreens and get yourself a cane for $20. So those are just some suggestions. Medicare will help you pay for some of the higher level equipment if you need it, but save that money for when you need it.
And then the only other thing I was going to say that just sparked that memory is once in a while finances become an issue for all of us. And if an individual is having difficulty paying for their assisted devices, there is a community resource, Care Chest, and Care Chest can help supply medical equipment, and that's a great resource to look at.
Great.
Quick plug for pickleball safety, so I think this is really important.
Not pickleball, but pickleball safety.
Pickleball safety.
Okay.
So if you're thinking of playing, get tennis shoes or pickleball shoes first. Don't play in running shoes. I see a lot of injuries from people that are playing in running shoes or sandals or some other shoes that don't have the support. And a lot of people get hurt on their first day playing. And number two is take a lesson on your first day. So they'll be teaching you some techniques for general safety on the court. I've had a lot of patients that got injured on the first day just going out and playing against an expert and then trying to do some crazy things out there. So yeah, for general safety, the correct shoes and take a lesson. Any trained coach will be teaching you how to play safely.
And realize none of us are 20 anymore.
Yes.
Yeah.
But I do have a patient that's in his 70s who played tennis at a very high level. He had West Nile actually affect his leg and had part of his leg paralyzed. And this was, talk about a mental change. He was still competing at a very high level in tennis and wasn't able to play anymore because he couldn't really run and he couldn't walk that effectively. But the pickleball court is pretty small, and he still hammers the ball. So now he's got a new game, and he's very good and can be competitive and really get a lot of those things that he enjoyed about tennis. So as we age, we might be changing the activities we do, but we can still find great enjoyment in them.
Yeah, thank you so much. Did I ask how many pickleballers do we have here in the audience? Just curious. A few, yeah, fantastic. And if we were interested in more movement and taking up pickleball, where would we go here in our community?
So at Cyan Park, I have a friend that does some free beginner lessons. She changes the times, but you can check on the website. So Cyan Park's in South Reno, so those are free pickleball lessons. You could also look at the PPR website, Professional Pickleball Registry, and you can find coaches in the area that are trained, and they all have to have that safety training as a requirement to be a PPR certified coach.
That sounds intimidating. Can you spell the name of the park?
CYAN as in Nancy.
Slam Park. Parkway Athletic Club have a pickleball court. I think they do pickleball here in the convention centre too. Yeah, someone's nodding their head. So if you just Google or search or reach out to us if you aren't having any luck, and we'll find where to go for pickleball.
And did I just see that they're filling that new pool up?
New what, sorry?
They're filling up the new pool.
Oh, the new pool, yeah?
Yeah, so that's also, yes, pickleball, but don't forget, there's so many things
swimming?
out there. So swimming is fantastic for anybody who does have chronic pain and wants to move. I am a huge advocate of water therapies.
Great, thank you, Jessica. So if you have a question, raise your hand. If we could keep it to one question per person, just so everyone has an opportunity. If you have comments or feedback, could you just hold that? And if we have time at the end, great. So just any stories or anything, just hold those. But specific questions for our panelists, just so we have time to get through, because I have had complaints about people sharing too much and us not getting through the questions. So if you wouldn't mind respecting that, that would be great. So let's start over.
Okay, I wrote it down like I was supposed to.
Thank you so much.
How does one know or assess if one has severe enough pain to get a referral to a specialist doctor?
If you're asking the question, the answer is probably yes. So, because patients who don't need the referral usually aren't considering it. And so if this is something that's bothering you enough and it's not getting any better, then I would say let's get a referral and take a look. I don't think it's a waste of your time or a waste of my time for us to meet each other and have a full exam. And sometimes I'll say, hey, you're doing a great job. Keep up with it. But I think that's still worth it.
And sometimes the sooner the better, because if you can address acute pain before it becomes chronic, that's also a plus.
Thank you. This side of the room, where are you, Grace? I can't see you. Oh, there you are. There.
This is for Jessica. Can you talk about secondhand smoke? Is it as bad as they say, or something caused my heart attacks, and I worked in a casino for a while.
I don't know if I'm the most appropriate person. Maybe, Dr. Keating might be more appropriate to talk about the secondhand smoke, but I think the research out there is it's almost just as bad as smoking. So yes, it can cause some of those changes physiologically.
Yeah, so secondhand smoke is smoke, but it's all about quantity. So if you went to a restaurant one time and somebody was smoking outside, that's not really that big of a deal. But if there's somebody that smokes in your house on the seat right next to you on the couch, you're essentially a smoker, even if you don't smoke.
Thank you, great question. Over this side. So you're getting lots of movement, Trish. Yes.
Thank you. I have an unusual question, I think. I have had shingles 6 years ago, and I continue to have nerve pain, and I take 2 medications for it, and it helps during the day considerably. If I touch the side of my head now, it would be painful. It's gone in my eyebrow, my eyelashes, my eyelid on one side of my head, and I can feel the difference in my skin even with it. And it wasn't a breakout like shingles, you see on TV or what your doctor shows you. It was just 2 spots on near the crown of my head. And I just wondered if you have any answers to that. I think that I have tried just about everything to try to control it. The worst time is in the evening, and so I have the itching, the pain. I use cold compresses to help out, and that does help considerably too.
Do we have any quick suggestions, or should this lady come up and talk to someone at the end?
So real quick, so post-herpetic neuralgia is what this is called. So after shingles, there's pain. It's a long answer for that question, but I think that you should see a specialist for this. We can talk offline.
Okay, yeah, so come up and see Dr. Keating at the end, and he might be able to point you in the right direction. Where are we, Grace? Yes, please.
Yeah, thank you. How do we find a physical therapist that's sensitive to us older folk? Not like a sports medicine physical therapist, but
I've already found one. She's on the panel here.
You know, it's funny. So I've throughout my career had several students that come through, and I tell all of them, I'm like, they're all so excited to do sports and orthopedics, and I'm like, that's not where the money is. So honestly, I think working with the older population is a joy, and it's something that most PTs should be proud to say they do. I'm not saying all of them do. That's a hard one, to be honest with you. I'm not going to give you any names of someone you shouldn't go to. If you are looking for somebody that's going to have your special needs, look for a clinic that you're actually going to sit down with your physical therapist. A lot of the PT clinics out there nowadays, to be honest with you, spend 15 minutes with your PT and then you spend 45 minutes with an assistant or an aide. And so that would be my first thing, is find somebody that you're going to actually sit down and you're going to spend 45 minutes one-on-one with your PT. And I would also just tell you, you don't have to stay with the PT that your physician refers you to. Your physician might send you to a PT clinic and you get there and you're like, ooh, I'm not comfortable here. I don't like being here. Then you shouldn't be there. It's okay to take that same referral and find somebody that is meant for you. And that's, and again, be your own advocate. If you don't feel comfortable someplace, go someplace else.
So I can just go back to my primary and say, I don't like that organizational person, refer me to someone else?
Honestly, sometimes you don't even have to go back to your primary care physician. As long as you have, and this is where when it comes to PT, we do live in Nevada, which is a direct access state, so you do not need a physician referral to see a physical therapist. However, if you have Medicare, you do. So it really depends on your insurance company, so check with your insurance company. If you do not need to have a referral, you can go wherever you want. If you do need a referral, all you need is that referral. So let's say your physician sends you a referral for PT for 6 weeks. You can take that referral and take it anywhere. So even if you have one visit somewhere and you're like, I don't like that, I think it's a good idea to go back and tell your physician that you weren't comfortable there, so that we learn in our community where we should and shouldn't be sending our patients. But you can take that same referral and go someplace else.
And then any suggestions, how might I find someone who's more appropriate, someone who specializes, someone who's my age as I'm older?
I mean, number one is word of mouth. Talk to your friends. Talk to your colleagues. Find somebody you do enjoy. Maybe you've got a medical professor. You're like, I learn a lot from Dr. Keating. Talk to him. Hey, who do you refer? Who do you think is good? So word of mouth is really good. And talking to your friends, I think that's one of the best ways. And we can talk about the star reviews and the reviews that you get on Google. But sometimes you just need to talk to your friends and coworkers and colleags.
Excellent. I think we have about 160 people here in the room, and when I said who's been to a PT, there were lots of hands, so make some friends here, and just show of hands, who's got a great PT that they like? Yeah, so any of those people with their hands up, that'd be a good start. Thank you. Question on this side? Yes.
This is for AJ, regarding neuropathy. There is a group in town that runs a commercial on TV about neuropathy, mostly feet and legs, and they lead you to believe that if you don't go and have them take care of you, that it will lead to amputation. And I just wondered if amputation is a common thing.
Great question.
Rarely have I seen people go to that extreme. And honestly, advertising is great. I think there's a lot of wonderful things that come from advertising, which is increased knowledge. But most pain management physicians deal with neuropathy because it's one of the most common things I know I see. Doctor, you could probably agree with that.
Yeah, it's one of the more common symptoms that people will come in to see me for, and there are a lot of different causes of neuropathy, so that will need a more exact diagnosis to have a more ideal treatment plan for that individual patient. And just know that there are people in town, because this is so common, and not just in town, that will have treatments that are not proven and they're not paid for by insurance, and they can be very expensive. Sometimes they'll say $10,000 out of pocket with some outlandish claims. If you're paying out of pocket, that probably means there's not any data for it, which means that's why your insurance didn't want to pay for it. So that's not 100% of the time, but that should be your kind of general starting point. So if it sounds too good to be true, most of the times it probably is.
And you're not seeing too many amputations required from
not for neuropathy. And for a lot of times, if there's a pain from a nerve, even if people did get it amputated, you've had the same pain because the nerve's coming from somewhere else. So that is not a treatment typically.
So some fear advertising to get the phone to ring.
Yeah.
I've never had a patient that had a limb amputated secondary to neuropathy. It's just not something commonly seen, let me put it that way.
Thank you. Over this side was, yes.
I'm speaking as a retired pharmacist, and I would say anytime someone asks you for your list of medications, don't give them only your prescription medications. They need to know all the vitamins and over-the-counter things you're taking as well, because they interact, increase or decrease the activity of some of your prescription medications.
Thank you. Where's our mic runner? So Trish is coming to the front of the room. If someone at the very back of the room could then put their hand up, and we'll get Trish going backwards and forwards. Sorry, Trish.
I missed the part about, you were talking about something for pain that was a tingly sensation. I totally missed that. Could you repeat it, please?
Yeah, it's called well, there's several different, but the most common is called a TENS unit. So it's TENS, like number 10 with an S. ENS, transcutaneous electrical neuromuscular stimulation. I know, don't write that down, just write TENS. And if you put that into Amazon, 1,000 will come up. So just be aware that there's a lot of options out there. But again, for $20, I feel like if it'll help, you should try it. That's when I would say maybe look at the reviews. Yeah, there's so many. I couldn't necessarily tell you which is the best company out there right now, but they should do this about the same thing.
But inexpensive. Do an Amazon search and look at the star ratings. And if there's like 10,000 people giving it a 5-star rating, it's probably a good one to try for $20. Yeah. Yes, up the back.
Oh, yeah. You were talking about TENS. Does that affect somebody that has a pacemaker?
Yes. You should not put it on around your pacemaker or through if you're pregnant, that kind of stuff. There should be a list of warnings, and pacemaker is definitely on there.
Okay, thank you. That was a question.
Great question.
Hi, is there something from a dietary standpoint or a vitamin standpoint that would help address muscle cramping, like in the calves or feet? When I do water aerobics, and sometimes it grips me with the muscle cramp, or at nighttime I have to jump out of bed and put weight on it. So I'm wondering,
Are you drinking enough water? That's the first question I ask people. Number one is drink enough water. The second thing that I do find for people that cramp, at least when I'm trying to give them stuff, is are you stretching before bed? That's also a good thing to be doing. If you're getting them at night, make sure you're stretching your calves out. You can use a rolling pin. I've got people that I just throw a rolling pin at and they just roll up their calves. But from what I tell people, it's water, stretching before you go to bed. But these lovely panelists will have more information.
And you can get some labs from your primary, so I'm hesitant to recommend taking any supplement or any element without knowing kind of what your levels are. So just get some labs from your primary. There can be a reason there too.
I agree with that. A lot of times people can have restless leg syndrome. That's something that we commonly deal with. I think a lot of people have experienced it. I too always agree that an individual goes to their primary care doctor to look at their calcium and magnesium levels. There are some great over-the-counter supplements, but I also recommend anybody that has a cardiac history and is taking cardiac medications, you do have to be careful with potassium, magnesium, and calcium because those can interfere with some of the cardiac medications. So again, just like our pharmacist friend back here recommended, make sure that you include any supplements that you take because they can counteract some of our more important medications. But there are calcium and magnesium supplements over the counter specific to like restless leg syndrome. Tonic water is another one of the homeopathic regimes that we use at home because it has quinine in it. and that can help with restless leg syndrome. But again, just like he was saying, I would not do any of those things without talking to your primary care physician or a pharmacist first.
And drink plenty of water.
Lots of water.
As I recently discovered, I blacked out on a plane recently flying to Australia. 5 hours into the flight, I blacked out. And so I got back and they put me through all these different tests and a whole lot of money, all these tests. And I eventually met with a cardiologist, I guess last week. He asked me a few questions. He said, you're dehydrated, you just need to drink more water, and don't drink wine when you fly unless you're drinking a glass of water for every, 2 glasses of water for every glass of wine.
Culturally, we are chronically dehydrated, our entire society. And we talk about, again, this is off the subject, but we talk about digestive pain. And a lot of that is from dehydration too, and constipation.
Thank you. Who's got the mic? I'll talk to you later, John. I missed
Hi,
that.
we're set. My name is Dennis Nerstead. I'm pretty old. I'm 86, but many years ago, 50 years ago, I got introduced to pickleball that you were talking about. And what a wonderful game it is. I flew to Seattle in 1972 and visited where they were built and got all the dimensions, and then came home. We worked a lot with the college-age kids, and I had a pretty good-sized backyard, and I put in a pickleball court. And we had a swimming pool, a pickleball court, and hiking up to the Mount Diablo, and we'd run them through there. But it just was a wonderful sport, easy to learn, anybody could play it, and it was just a wonderful thing. I just wanted to share that.
Thank you, Dennis, for sharing. Yeah, awesome. Where's Trish? Over here? Trish will be to you in a moment. Any hands on the left-hand side? We've got time for a couple more questions. Let's take the one over here with you, Grace.
It's about plasma-rich blood, or blood-rich plasma. Are lots of blood in your plasma? I'm not seeing any recognition there.
Dr. Keating?
So for platelet-rich plasma like PRP, yeah, in what setting? So it's used in a lot of areas.
Pain?
Where's the pain?
Okay, this is a new treatment that I heard about, so I'm not sure how to answer you.
Yeah, so the data's mixed. I think there probably is something for it, but that's just my opinion. It's not mainstream, and it's out of pocket right now. So this is one of them that has some data for it. There might be something for it, but only in certain areas in the body. So it's kind of being used everywhere, but there are some areas that have better data than others.
Is that kind of something that's coming along?
Yeah, it's kind of a longer answer. So it's a big catchphrase of platelet-rich plasma, but there's a lot of different qualities. So there's a lot of different ways it can be done in a lot of different areas, and not all of them are the same, but they all kind of fall under the same bucket name.
Thank you.
Hi, this is a comment rather than a question. I'm a retired PT, and I want to thank you guys. It's a really well-balanced program you've put on. But for anybody here that gets their health care through the VA, polypharmacy is a real big deal with the VA. And so anybody that's taking a lot of meds, like me, I'm going to be asking my doctor for a referral to the pharmacist to go over mine, because it is a big deal. And then the second thing, the VA has a program called Fit But Not Forgotten, so that if a person wants to do an exercise program, the VA has a deal through the Evelyn Mount Community Center, where with a doctor's referral, you can get all the programs at Evelyn Mount free. And one that my wife browbeat me into, I should have known better, I should have gone into just on my own, but they have very good water aerobics programs, and water aerobics is great because you are in a warm, supportive environment, and it really works on limbering you up, it works on core strength, the program's real balanced. And for a lot of the folks who are in there, it is a great social thing. They get together, it provides, kind of mental support, because you can start off just as easy as you want and catch up with the people, and no one there is going to be judging. It's not like going to the gym where everybody else is Arnold Schwarzenegger and you're not. So it's a good program.
Thank you for sharing that.
Yeah, I do think water aerobics, water therapy for somebody with chronic pain is a fantastic way to start getting your body moving again.
So before we wrap up, we've got like a few minutes. I guess we could probably take 2 more questions if anyone has any questions. Going once, going twice. Over here, Trish. You guys have been great. You've answered all the questions, and this is awesome. Oh, wait 1 sec, Sue. Microphone to you.
I don't really have a question, but one thing that wasn't mentioned for pain is massage. I had a bad accident, and my whole right side was in a lot of pain for a long time, and I went to doctors and everything else, and nothing helped until I got a massage, and that did it. Boy, I was so happy.
So good for you being an advocate for yourself and trying different things, kind of like I think a couple of us had mentioned. So yeah, one thing doesn't work, try something else. So I just want to thank you all so much for being here and taking the time to come along. And yeah, just a big round of applause for our fantastic panelists for sharing their wealth of knowledge. And hopefully look forward to seeing you next month, declutter or downsize.